Hey everyone, Dr. Ashley here from the Feldman Physical Therapy and Performance team. As always, thanks so much for tuning into our YouTube channel. Today, I want to talk about something that may seem like common sense, but it's often a forgotten thing amongst many of us. I've been there, and I'm sure you have too, and that is as the nicer weather approaches, doing too much too fast. And what does that do? It puts us in harm's way for injury. That's not something we want. So what I want is for you to stay tuned to the end to make sure that you learn methods to monitor yourself so you don't end up having an injury or those little niggles that pop up every single year as you get back to doing what you love. As always, we're so grateful that you're here. If you have questions, comments, please make sure you put them down in the comments section. And if you haven't already, make sure you hit that subscribe button. We love providing you guys with the latest and greatest information. So let's get started in giving you some information as to how you can monitor yourself to make sure that as you're starting activity, whether it be running, gardening, hiking, or anything of the sort, that you don't get injured along the way. Every change of season, especially going into the spring and summer, I see the exact same thing happen year after year. Activity-related injuries increase. So as the weather warms and we're all getting antsy to get outside and play, I want you to remember this one thing. We all think we're inevitable until we're not. I've been there, and I'm sure you have too. As the weather starts to warm, all we want to do is get outside and do the things we love. But what you have to remember is our bodies are only capable of what they can tolerate. And if we haven't been preparing our bodies over a period of time to get back to doing those things outside in the spring and summer, more than likely we're gonna have a little bit of breakdown. So I wanna take the time to talk to you a little bit more about how you can possibly use a model that we use for athletes to help make sure that you don't have injuries as you're getting back to doing the things you love. Young or old, jumping into any activity too fast can be detrimental to your body. Why? Too much stress too fast is not a good thing. The one thing that we need to remember is this type of injury, this activity-related injury, can happen no matter how old you are. We see these repeated and stress-related injuries occur in athletes of any age. Whether you have a youth baseball player with a kind of overused shoulder injury or an elderly individual suffering from neck pain thanks to gardening, they're all similar. They all have to do with doing too much too fast and doing more than what our body can tolerate. So let's talk a little bit about how you can monitor this. And I want to compare it to a model I use with athletes. The reason being I think it's pretty practical. I think that this will give you a way to think and say, ooh, maybe I did a little bit too much. And maybe next time, season after season, you won't experience that same pain. With athletes, I often use something called the acute chronic workload ratio to basically monitor their training load versus their actual fitness level. Think about that. In layperson terms, we're looking at how much you've done in a short period of time versus how much you've done for a longer period of time to make sure that you are ready to perform the things that you like to do. So how does it work with my athletes? Technically, I take a period of 7 days, so that would be the training load versus a period of 28 days, which I consider the fitness load. And if one is much, much higher than the other, then we might have an issue. What that might mean is either you're not doing enough to make sure that you're staying in shape, and the other one, you're probably doing too much and you're at a higher risk for injury. So basically, if I see a training load, all right, that is 1.3% greater than the actual fitness load over those 28 days, you're at a higher risk for injury. And I want everyone to take a step back and think about that a little bit more. If we're talking about this in regards to yourself and wanting to get back out and garden, or whether you're going on hikes, or whether your child's starting to play athletics and do sports again, think about how much they've been doing before that. Because if they hadn't been doing a lot, that means they could be at risk for injury. So going from 0 throws to 75 throws, that's a lot. Think about that. Or spending no time in your garden versus spending hours in your garden. No wonder why things might start to hurt. So I want to talk about how you can monitor this a little bit. So let's go ahead and do that a little more. I'm not going to go into the math as to how I actually calculate the acute chronic workload ratio. It's a really great thing, especially when working with athletes. And if you have any questions about that, please don't hesitate to ask below. But the one thing I want you to think about is how monitoring your load, your workload over time may help prevent injuries. If you are an individual who has started an activity and has ramped up really fast and you're starting to feel aches and pains, more than likely it's because you did too much too fast. So what can you do to track this? Grab a journal, write down how much activity you're doing on a daily basis, and look at it as compared to the monthly average that you will calculate over a period of time. If you notice that your workload is increasing incrementally, okay, week by week, that's okay. If it's increasing significantly and you see big spikes, that may not be okay. And you need to make sure that you are doing what's best for your body so that you don't have those injuries, those niggles that pop up year to year. Every year I hear a gardener complain of back pain. I hear a runner complain of knee pain. And I hear a little league athlete, whether you're softball or baseball, complain of shoulder pain. And most of the time it has to do with doing too much too fast. So everyone, as always, if you have any questions about this, don't hesitate to ask. I just want to simply remind you, we need to do what's best for our bodies, and rushing into things and thinking that the inevitable would not happen, unfortunately, it does, and injuries do happen when we push our bodies too hard.